Thank you, David. Pat, did you want me to go ahead, or did you want to start? Can you all hear me?
I can hear you, Scott. I'm not hearing Leanne either, and I believe you can go ahead.
Okay. All right. Okay. I guess we're just going to go through the comments, and I'm gonna start. I'm actually looking at my version because it's larger here. So I think there's just an editorial comment with background from Kat about the table number there under the background section, which I think starts page 54. But then the next here, there was, David, you had a comment about the statement about the percentages in relation to that chart that follows regarding averages. And yeah, we're gonna correct that because I think we kind of mixed apples and oranges here with that, with regard to tick-borne disease cases reported versus Lyme disease cases reported, and then the true incidence with those. So we will straighten that out and get the.
Yeah, that's gonna give you a more impressive lower percentage of Lyme disease cases. It'll improve your argument.
Right. It would. With that, it would be with the 13%. I mean, this table also, I think you can look at it in terms of just the overall percentage of Lyme out of all reported tick-borne disease cases. So we'll work out the language for that. Yeah, I'm not quite sure. I'm assuming I wrote it that way, which was not my intention because it doesn't really match up with that chart the way it was supposed to. So yeah, we'll take care of that. The next one, I think, again, David, you had the comment. I think, at this point, I feel like we're just, treading over the same ground here with a lot of these comments that, we've gone over this, and I think from our public comments, people evidence that, we're just really, particularly this chapter, it's like we're going over this stuff with a fine-tooth comb when I thought this was settled already. We either didn't have votes or we had votes on things with regard to language. So I'm not quite sure what to do with the bulk of these comments in this chapter because they're just the same comments over and over again. I thought we had reached consensus on this. So
well, the fact that this has nothing to do with the recommendations hasn't really been addressed.
Well, it does. I'm sorry for the dogs in the background. They've been quiet all morning until this point. They do have to do with the recommendations, and I think we've talked about this endlessly. And the fact is, this is really getting embarrassing, I think, for the work group. The number of comments on this, and just, on one meeting, it's one sentence in a section, and we kind of get to a point, and now we've had another sentence. And it's
the whole paragraph. I meant the whole paragraph. The whole paragraph has to do with things that you all want to put into a chapter that don't belong in this chapter.
Well, I mean, I'm getting the feeling that there are members of the working group that just don't want this chapter at all in here. Because, I mean, it really has been. It's like an assault on this chapter that's been ongoing. And it's been a waste of time. It's not effective. It really doesn't promote consensus. And
you've taken the advantage of being authors of a chapter to launch into topics that have nothing to do with the chapter that you won't want to put into the report that really has nothing to do with supporting the recommendations of the chapter.
David, they do support the recommendations. Plus, as Jim noted with the charter of the working group, one of the things is affordable access for patients to care that restores health. That's in the charter. So,
you won't need to get that into recommendations, and I hope that you will do it in the 2022 report because you have not done it effectively at all, anything to do with access to care and the recommendations of this chapter.
you're welcome to do a minority response to this.
Well, that's why I'm telling you this, because there will be.
If there is a vote, then you can do a minority response if you're in the minority for the vote. But we haven't had votes on some of these things. So, I think to go through each of these comments, for the most part, the only valid and reasonable comment was that one we just talked about the numbers. I really don't think there's anything else in here that there might be one other comment, but these are just the same comments over and over again.
Well, let's go through them. That's what we're supposed to be doing today.
No, I don't think so, David. We've done this now for many hours and hours and hours and hours, more than probably the rest of the working group reports put together. And we've addressed this. We've addressed these comments that don't have any real specific, asks and so on and so forth, just to remove. It doesn't support this. That's been all the way through. I don't think that we need to go any further. I think we've done our part, and we're willing to move along because we don't feel that we need to discuss this any longer.
You're wrong, Pat. You have not addressed these issues, and if we would just go through them, I would appreciate it. And that is exactly what this hour is set aside to do. And Jim Berger, would you please weigh in about our protocol for what our agenda is today?
Well, wait a minute. Before you do that, I would go to the protocol of last meeting's agenda, which what you did was you went back and you voted on things that weren't supposed to, reports that were not scheduled to be voted on. You took up all that time, and then you got to our report and you cut it off. And the reason you cut it off...
Last time you spent 2.5 hours talking about minority reports, and when in fact everyone agreed about it. You had a right to put minority reports in, other people did, but you took 2.5 hours to delay our moving through the meeting, and that's what was taking all the time up last meeting.
Excuse me, but that was not my issue. That issue, because you worked behind the scenes to change protocols, and then you did not want that brought up in public. And I brought it up in public, and I'm very happy that I did. And you could have...
Your accusation that I've done anything behind the scenes is completely wrong. I did not.
Comments in last time. You didn't. They weren't there for the last meeting. So we don't need to go over them. They're the same comments as always. The same thing. We need to move ahead. We do not need to beat a dead horse, if you'll pardon me, and that's what's happening here. Every meeting, time and time again.
You're trying to brush over this chapter and railroad it through without listening to the critiques, and that's wrong. That's not what this is about.
Railroading hardly describes the process. I would be happy to have people compile the numbers of hours that we have in the transcripts, which people have taken down to show how much was done with our chapter compared to others, and what stringent, very stringent criteria we were held, including all of our citations compared to some of the other stuff that was put into other chapters that nobody looked at or talked about until I noted it, or maybe one other person noted some of those. And so
this chapter is the outlier in going off the deep end of topics that are unrelated. That's the reason it's been under discussion.
Can we get Dennis here. I'd like to make a comment at this point. This is Dennis Dixon. So I think what we're looking at is a fundamental difference of opinion on the overall chapter. And I agree that further discussion of individual comments is not going to get us any further. I think we've had ample communication. Differences of opinion have been expressed, and yet we have not come to a consensus. So I think we're at the point of needing to vote on the overall chapter, because it's not individual comments, it's the overall sum of the balance of the chapter. And I feel that there is not an overall balance of the chapter, and I am uncomfortable on the lack of balance and the misrepresentation or the depiction, I'll just leave it at the depiction of the clinical trials from NIH overall. For example, they're listed as 3 grants, and in fact, there's 4 trials, 2 of which were done by contract under the Klempner publication, and 2 additional trials done under grant. which were by Fallon and Krupp, so there's those details, but it's the overall focus on the minority findings of those studies rather than the overall preponderance of evidence that additional antimicrobial therapy does not provide additional benefit, shown in the 4 U.S. papers and the European paper. Add to that the overall depiction of Ilabs versus IDSA, and I think that's a good way to characterize the differences of opinion. And so I'm just not comfortable with the way it is written as such. And I think maybe what we need to do is call it to a vote and see how many people feel that way and how far apart we are before wasting additional time on individual comments, which aren't really the point.
Well, I would say, Dennis, you know what? Thank you for your honesty, in quotes, and I know you're espousing what the party line is, and that is the problem. The party line for 46 years has been, let's bury the patients. I have never, and I've worked for 36 years as an advocate for people with chronic Lyme and for other tick-borne diseases, and I have never in my life seen the hatred or felt the hatred that I've heard from some people in this group over providing information that is totally verifiable. We have sources coming up to wazoo, but you don't want to accept them. David doesn't want to accept them. Shapiro doesn't want to accept them. I don't know who else doesn't want to accept them. Nobody else gets the same scrutiny. This group was willing to accept a 1904 piece of citation in this report, but we have citations coming up from the best institutions over many years, and you don't want to accept it. Nobody said here, and you wouldn't allow it to be said. It was said in the first working group, but no, you can't say chronic or persistent Lyme exists. Well, you know what? I think that the community is tired of it, and with other kinds of things are going to happen because this working group, and I'm not saying this to everyone here because most of you have been very, I believe, cooperative in working and trying to get to a bottom line. But some of you have not, and now we get to the 11th hour, and what a surprise. You want to deep fix the report, the only report that addresses what happens with patients. And I'm sorry that you think that the NIH is sacrosanct. You think it's so sacrosanct that the bodies of people that were charged with doing research and talking about what research should be done, we're not even willing to take in chronic Lyme research. That's why we couldn't get it done. That's why we couldn't get it published, and so on and so forth, and that's happened for years. And so you're not sacrosanct. The NIH is not sacrosanct. And I happen to think that we have to do something for the hundreds and thousands and now millions of people over the years that have been affected. And the government doesn't want to do anything about it. And so I don't know why you're sitting at this table if you don't want to do something. We've compromised plenty. We've removed tons of stuff. And we've compromised the fact that Lyme is the most prevalent tick-borne disease. And it's affecting the most people, and not only that, it's more people who are not able to get treated because the government doesn't want to recognize they're sick. You want to send them all to psychiatrists. I've had people that I know personally that have been put in psych institutions and weren't able to be treated and had grave difficulty to get out and be treated for Lyme, and they got better. And this includes children. Well, I'm sick of it. I saw a floor full of children seizing in the 90s from Lyme disease in a hospital. What did the hospital do? They had the audacity. When these people had remissions, call them what you will, from these seizures, they took videotapes of the kids talking and said these kids were faking. This is a tragedy that has gone on too long, and somebody has to do something. I had high hopes that this group was going to be able to do something, and I am disappointed. I shouldn't be, because my hopes shouldn't have been that high. That's it.
Pat, I agree with you that we need to do something for these people who are suffering, and that's why I'm so firmly committed to the research section. how we need to explore and understand better the pathogenesis and suffering of the individual so that we can intervene with the most appropriate methods in a scientifically rigorous fashion.
You had 40 years to do the pathogenesis and get it solved. Let's look at COVID. Let's see what was done in the 9 months' time, and I'm speaking as a mother of two with COVID. And so look what has been done just in that time period. You had 46 years. And what did you do? You covered up a disease. I remember it from the 80s, from the 90s. You tried to cover it up as a disease. You tried to cover it up as a spread. Then you went and tried to cover up Babesia and where it was. And it isn't just CDC. It's NIH, too. And it's about time somebody stood up and said, yes, we have to do something that's going to directly impact on getting help for these people that are so desperately ill. I had a daughter for 3 years.
We're trying to uncover, not cover, we're trying to uncover the mechanisms of pathogenesis to understand the basic translational and clinical means to address that.
Oh, yeah, and you didn't have time enough or money enough. I saw the inventories. I know what you did. I know what you should have done, but no, that wasn't done. And I only saw a couple of years of those inventories. And so you're never getting to the bottom line. And people said it this morning. Where is the help for the patient? There is none. And now you want to remove their chapter. Well, go ahead. I'm going to tell you what. We're going to, we're going to do things with Congress that this group cannot do because it's obvious some of you don't want to do it. And again, please, the other people in the group, and you know who you are, I'm not speaking to you right now. I'm speaking to these people who have prevented this from moving forward. It's just unbelievable to me how a few pages of a chapter have been so attacked.
But Pat, I believe that the survey that you did in there really is exemplary of a group of people, thousands of people that you've surveyed who are suffering, and they definitely need to be helped, and we don't really know what's wrong with them. The problem is that they're self-reported saying that they believe they have persistent Lyme disease.
If you had listened to the prior meeting, David, you would have heard.
The criteria don't meet. They really don't. They just say they've had Lyme disease, and the high rates of co-infection with respiratory illnesses like mycoplasma and cat-transmitted illness like Bartonellosis really indicates that there's something else going on. And these people definitely do need help, but the help may not be Lyme disease, and if it is Lyme disease, we need to understand how, like Dennis Dixon has just said. And your portrayal that I don't care is entirely wrong.
David, we discussed this patient registry. The patient registry, those people in that registry were asked if they had a doctor diagnosis. And if they did not, they were removed from the registry. There are tons of patient registries. And you just want to pick on this one because it doesn't meet your needs. This is typical. You want to take evidence, the evidence that you want to show that this isn't there, but the rest of the patient registries of the world that the NIH has or that the CDC has or other agencies or other respected institutions have, you don't come out and say anything about those. Those registries are used everywhere. You only care because this one shows the true extent of problems across the United States and across the world. And you've had 46 years to do the research to come up with what is wrong with these people if this isn't what they have. And you know what? Not only haven't you done it, you've relied on mainstream medicine, which says they can't get more treatment in any way, shape, or form. They're not permitted. They're told to go to a psychiatrist, even alternative medicines and so on and so forth. Said, nope, forget it. You can't have them. We don't recommend that. Well, you know what? That is unconscionable, totally unconscionable.
I move that this chapter be accepted with possible minor revisions.
So, Sam, would you be willing to break that into two sections? One on the recommendations, and two on the content of the chapter?
No, he can't, because we've already voted on the recommendations.
But that's
part of the chapter, David. So unless we want to hear, and it's part of the discussion from other members of the working group, my motion stands that we move to accept Chapter 7 into the report.
I second that.
I'd like to make just a few comments based on the statements that have been made. I think it is fully acceptable to express frustration that at this point in time, there seems to be, like, I don't know if the right word is new, but I think it's fully understandable to express frustration that we've gone through months and months of well-defined process to point to the opportunity where people can express in the share drive and in the public meetings when they did not like certain sections, when they did not like certain areas, and have the opportunity for dialogue and opportunity to make suggestions for changes, et cetera, et cetera. So here we are at the 11th hour, and I agree with that statement, that this is not the time to start bringing up all over again if you don't like something, like, and try to say, okay, now you don't like something almost from scratch. This is not that time. We are coming together as a group and trying to bring it to a close for the goal as a group, not our individual desires. Because believe me, there's a lot of things in here individually I do not care for. But that's not my job. I wasn't, quote unquote, hired, and that's not the right word, but I wasn't hired to bring my personal things in here. I was brought in to use my personal background and personal experience, etc. But I brought in as a group, as a working group member, collectively, to serve the objectives of the working group. So now, as a working group, at this 11th hour, we're supposed to compromise and decide what we want to represent. And guess what? We have that opportunity for the minority report. If we vote something down, we can choose to still put a minority report forward. So I think we just have to agree to the process. We have an hour for this chapter, and we've probably dug into a lot of it already. With that said, this is also not the time to go back to 25, 30, 40, whatever years of history of what has happened in the past. We don't have time for that. And it's painful history. And okay, everybody understands that, but we can't drudge all that up. We don't have time for that. And it doesn't serve us. This is a meeting. This is a meeting. This is not a documentary.
I think we need to be clear on the outcome, too.
Hold on. I'm sorry, one moment, please. We need to come together, okay? We are going to put forward a vote. There's a motion on the table. If you don't like that motion, then we'll move to the next motion. But we need to come together. We need to come together and serve the purpose of this chapter. All of you, everyone had an opportunity, months and months of opportunity, to take the sections you like, to put in your comments, to decide on what you wanted in this chapter. And now's your opportunity to either vote it through or make some minor suggestions on different sections. This is it. This is the last meeting. The next meeting is the icing on the cake. Please.
Could I make a statement about the outcome? Because I want to be sure
yeah.
we're all clear on what the vote means. So my understanding is that we vote yes or no on including the chapter. The chapter won't disappear, and we won't have no Chapter 7. It'll depend on the vote. If there's a minority of opposition to the chapter, it will stand, and minority reports will appear. There's a majority of opinion not to have the chapter in its present form, then a replacement form, I assume, would have to be put in place, and if people don't like the replacement form, a minority report would appear then. I don't think it just goes away. And I see that as a way to recognize that there is polarization on the overall expression of the content, and that itself is meaningful. And I've heard before, even you, Pat, who had said it's okay to disagree on something, you just need to state your position.
And that is correct. And I would certainly be very happy that we proceed on this vote. And quite frankly, if it goes down, I would love to be able to present to Congress how this working group voted against a chapter, the one on the patients, and the one that the patients had the input into and had it well-crafted, well done, and spent hours of discussion on. So I would be very happy to do that, and we'll do that if that's what happens. So yes, let's move on and let's get the vote going.
Sam here. I'd like to encourage the group to actually vote in favor of including this chapter with its current content, and then have a minority report point out the various points of difference. To do it the other way is going to be a little bit more difficult as I see it. That is, as Dennis said, we'd have to replace the chapter somehow. And that's like we don't really have, that is important to just say we don't have the time. That is part of it. But I think it would be best to go ahead and vote the chapter and go ahead and supply a report that to me, if we want to focus on one or two comments that is other than wordsmith, that is valuable, I'm happy to do that. But to echo Leanne, we don't need to revisit everything that has gone on before. Let's just move on, and hopefully the rest of the working group can either chime in during the discussion or let's vote.
Thank you. I do need... I'm sorry, I
need
clarity. I apologize. I need clarity on Dennis's statement because this is the first time I'm ever hearing that. It does affect this motion on the table. Dennis, if you could please restate what you said. I've never heard that before, and if it's new to me, I'm sure it might be new to others. If you could just clarify what you said, that would be helpful. Just please reiterate it. Thank you.
Sure. First of all, I'm stating my assumptions. I don't know if these to be the facts. It just seems to me this is the way this has been progressing all along. When you have votes yes or no, then you proceed from that point. So if the vote is to reject the chapter, I don't think it disappears. I think it means we don't like its current form. And then there would be someone would have to rewrite the whole chapter or write it in a way that is acceptable to the majority. And if the majority vote is and if that happens, if people don't like the new version, there would be a minority report as to why that's not acceptable. And conversely, if the vote is to retain it as Sam has proposed, then those that don't like it that way would vote against it, and the opinions would be expressed in the minority report. So I heard Pat's concern, rightly so, about there's lots of good, valuable information in the chapter. I think the point is whether or not you think there's an overall balance, and if you think there's a significant problem with lack of overall balance. In that case, Sam, I think it's hard to ask those of us who feel that way to vote to accept it in its present form. But does that answer your question? I mixed a lot of concepts together, so I think that an option isn't no chapter 7 at all. I don't think that's a possible outcome. Is that correct, Jim Berger or Kay Haynes or Jennifer or anyone else?
Dennis, that is correct. This is Jim Berger.
So this is, I have another
I would like to say something about the fact that these comments that are put in here were put in here by David. They're the same comments that have been put in there before. And he did not put in there, and we were scheduled on the agenda last month, in the last meeting, and he didn't put these comments in there. So therefore, he cannot go back now and put these comments in and expect that we need to address them. We've addressed these 1,000 times over, and there was no reason for them to be put in here. It was on last time's agenda, and it was pushed, in my opinion, to the end, as it always was, so that we could be sacrificed and move again and again until now we're at the critical point. And about this chapter and whether it will stand or not. I mean, this is ludicrous to me, and I would like, and at this point, I call the vote.
Okay.
So, first of all,
I'm not ready for that. There needs to be discussion on this. This is a very important decision. Okay, and we need, all of us, we need to pay attention to our tone. We're trying to calm this down. We're not trying to make it more caustic, okay? This is important, and everybody's trying to make this work. We're not trying to make it not work. So let's pay attention to our tone. And it also is about respect. Here's what's important about this decision, okay? I'm trying to understand what Dennis brought up because it's news to me. I don't understand, if someone could explain this to me, I don't understand how I understand there's a motion on the table, but what does it serve to start over in writing a whole new chapter, which would present all new opportunities for disagreement, okay? At the 11th hour, when we can't even come to agreement on this chapter. When the process is, we've had months to come to agreement on this chapter, and we don't agree. It's a chapter that presents many opportunities for disagreement. Therefore, the solution is, if you don't agree, present in your vote as a minority on either the whole chapter or your vote on certain sections, and provide a minority report. That's not what we have on the floor. The motion on the floor is to accept the chapter. We'll fix the first comment because that was legitimate. It was confusing, and we will fix that comment. These other comments should have been done at the been put on before the last meeting. They were not. And wait a minute, excuse me. And as far as tone and respect, you have got to be kidding. Let me tell you, you have got to be kidding. After all the things I have heard and seen, how some people have reacted to patients, to our sick patients, they are the ones that deserve to have the respect. They have not gotten it. And so, therefore, we have a motion on the floor. I called the vote.
Well, first of all, the motion hasn't been seconded. Secondly,
it is seconded.
I have a question. Could somebody please clarify what the requirement is for a minority report? Does one have to reject the chapter? Can one accept the chapter but object to specific to content? And how does that happen? Because it sounds like we've only had motions to accept or reject the chapter. So, Jim, can you clarify what needs to happen to have a minority report included, please?
Okay, it's my understanding that for a minority response, there can be either a rejection of the chapter or a rejection of the comments.
Okay, thank you.
But that has to be in response to a vote. That has to be a vote on particular sections, and that has not been done. And therefore, right now, we have a motion on the floor to accept or reject the chapter. So if someone votes not to accept that chapter, well, then they can do a minority report. But there's nothing right now about any kinds of sections. And so we have a motion. Sam motioned, and I seconded it.
And I would add to what Pat is saying and what Jim said, when it comes down to a vote on an entire chapter, then the dissenting opinion that's written, everything in the chapter is fair game. If we're voting on a specific part, then the dissenting opinion can only talk about that particular. But in this case, we're voting on the whole chapter. So to Gene's question, Gene's opinion could be on anything.
We lost you there, Coop. We lost you there, Coop, and that would be an important comment if it's possible for you to restate that.
So can you hear me now?
Yes.
Okay. So what I was saying is, in this case where we're voting on the entire chapter, whatever way the vote comes out, if you're someone who's dissented in the majority, from the majority, for the entire chapter, your opinion that's written can cover that entire chapter. If we were voting on a specific section, that would be different. The opinion would have to stick to that if you were in the minority. But in this case, that's not relevant because the motion by Sam and seconded by Pat was the entirety, except the entire chapter as is, other than that first one we talked about with the numbers and percentages, which we will correct.
I think where the confusion is...
I almost wish the chapter could depict a point-counterpoint. I mean, everyone knows there's polarization on this topic and there's strong feelings on either side. So acknowledging that is okay. And if there's a balanced depiction of the two different approaches in general, that would seem to be a service to the community and to Congress.
Yeah, this has been, I couldn't agree with Dennis more. I mean, certainly CDC's clearly supportive of the recommendations. And I mean, honestly, I'm not so much against what's written here. I think it's what's not here, and I think it's the whole idea of showing the balance. I mean, I'm fine with registry data, but I think that, David makes a good point, and we just should point out the limitations of registry data, and we should, but, there's truly a point and counterpoint to this, and this is the dilemma in which we live, and we need to work out a way to answer these questions and resolve it. But I think the way the chapter's written, and Leanne, to your point, I don't think that it's fair to say that these were 11th hour comments. It was something that was brought up very, 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 very early on, and I think in support, of those who've been outspoken about this, that the balance just has not been put in there. In that sense, the comments have never adequately been addressed. Again, I'm supportive. I think what's in here is good, and this is an incredibly important chapter, and it doesn't need to be deleted or even rewritten. It just needs to be balanced with the other side of some of these issues. That, to me, is really the issue at debate here.
I think that's fair. Sorry, Pat, I just finished my statement. I just wanted to add to what Ben said. All I'm saying is that what you just said, Ben, is a great point that we should have just had in the comments. Like, you know what I mean? So that when we kind of better knew where we stood.
So I think that one of the criticisms or comments were made without offering an alternative to what was already written. And now we stand here at the 11th hour, Ben. I think that these comments, this chapter has been this way for a long, long time. And it's okay for us as members of the group to question or provide a comment, but wouldn't it be more helpful to have also added, then I would like to see it phrased this way for better balance. But now, how are we going to do that? Are we going to delay this yet again to find a better balance until December 2nd or have another interim meeting of some sort? I think we're stuck here.
Yeah, thank you, Sam, and thank you, Ben. I will say, but in defense of what Pat and I have done throughout this process, I feel like we've acted in good faith to address the comments that we've gotten. all of them, unless they were just criticisms without any constructive part to it. As Sam was saying, there was nothing offered, and I will say this last round, the preponderance here is just the comment, this is irrelevant, and with nothing to offer. So I need that, if that needs to be pointed out, particularly to the public listening in, because they might not be able to see these comments, and just we're not going to go through each one. A lot of them are just that. And we've gotten those in the past. And there's not a whole lot you can do, but we've addressed even those in the past, to explain why it's not irrelevant. So I think, we're at really a point here. We've acted in good faith. We've tried to respond and work together. But I think we are at the point where Sam put the motion, Pat seconded it, to either accept the chapter as it is, other than that one area, or to not accept it, and then we'll proceed from there.
So, just a point here on trying to flesh out what's meant by balance versus why didn't you bring up individual comments. The overall tone of an entire page is hard to fix with one or two comments. So if you just focus on the text about the NIH trials and include the European trials, which are even bigger and did the same thing, you see such things as comments about the poor design. You see inconsistencies in results. You see controversies. So the results are rather consistent. I think the disparity is in the interpretation of the results. So if you look at the very fine European trial done by Bart Jan Kohlberg and his colleagues, and I've known Bart since the early 90s when he came into infectious diseases and oncology at the mycosis study group, a clinical trial network that I led for 15 years. He took on the challenge of Lyme because he noted previous randomized trials have not shown convincingly that prolonged antibiotic treatment has been beneficial to patients, which is, it's true. The trials have shown that that additional drugs are not beneficial, and yet there's controversy over interpreting that. So they decided to do another trial, and it had 3 arms, and they took people with defined criteria, and they gave them 2 weeks of ceftriaxone IV, and if they had persistent symptoms, they randomized them to 3 arms. And there was no difference between placebo and treatment in that group. So they summarized in the result, the overall preponderance of evidence is that there is no benefit from additional antimicrobial therapy. This is written almost the opposite, in that there is no data to show that additional therapy would not be beneficial, or that there are elements taken out of a secondary endpoint for one of a global score to show that that part of the global score improved at week 6 but not at week 12. So it's that overall feeling you have at reading the entire page. It can't be fixed with a sentence here and a sentence there. Well, so that's just an example of how that pervades the chapter.
Excuse me, Dennis, but I believe you were at most meetings, and if you weren't present, Sam Perdue was. And to give you both credit, you made the meetings. However, we discussed that issue very clearly and in response to those comments many, many months ago. And we said, no, we're not talking here. We're talking about U.S. trials. We're not talking about trials in other countries. We were very clear about it. We said it. We stated it. We made changes to that whole section, many, many rounds of changes to that whole section, and no one ever brought it up again. And now that you guys have pushed this till the 11th and a half hour, and now you want it rewritten again, and you want to bring up all that old stuff again. Well, sorry, Dennis, but we're not going to do that. We're not going to bring this up again. That was already discussed. You can go back and find it in the transcripts, and if that's the case, but it's there. And we're not going to do this again. And I call the question. We have a motion and a second on the floor.
Another interpretation of that, Pat, is that the changes that were made did not have significant impact on the concerns that were registered.
That is not true because no other concerns were registered on that aspect after that. The only concerns that have been continuously registered are concerns that don't provide anything and just say that doesn't belong in the chapter. And so we've addressed everything and then some. And I have my conscience does not at all feeling anything about that because I know we went above and beyond the call of duty to get this to a consensus state. And, and then to see now, here you are, and you're going to shoot it down. Well, please be my guest. Shoot it down. Because I'm going to tell you, it's about time that this nation understood where its government stands on Lyme disease, in particular chronic and persistent, and those patients. I think they need to see it clearly. And believe me, this will drive it home. I'm perfectly fine to go with this. And we have a motion and a second on the floor. Let's do it.
I have a question for you. Does your decision-making section, is it trying to force physicians to offer ineffective, dangerous options to their patients?
Well, I disagree. David, you cannot make that kind of statement without more experience. And Dennis, we've talked about the European trial, and it had a big fatal flaw, which was duration of treatment, a couple of others. So let's not presume that appropriate duration of treatment, which is the key to the critique of all of the existing trials. And whether that's correct or not remains to be seen, but needs to be supported. We can't be dancing around that there's another cause when it's staring us in the face. Again, this goes on, and I guess if the chapter gets voted down by the working group, gets voted down, and we'll have to take it from there, following Jim Berger's and Kay's and Jennifer's. I can't let it make the assumption in the rest of the working group that may not have as much experience with taking care of patients don't really know whether they need their alliance to go with one person or another. But I think the chapter, everybody agrees it's valuable, so let's put it in there and then critique it with your individual minority reports after the vote, or if it's voted down, then the minority report will have to go the other way.
I want to address David's question. And David, here is my response. First of all, it's not my judgment. I'm not a physician. I've never pretended to be one. However, I can read, and I can also assess information that's provided by the tens of thousands of patients and physicians across the country. And I can look at Ilabs Guidelines, which were the IOM approved the way the Ilabs Guidelines were developed. They were the last ones on the National Guidelines Clearinghouse, as a matter of fact, before the government defunded the clearinghouse. And so those guidelines stand up. They give the doctor the right to make a clinical decision based on what they see and also based on the kinds of testing that they do and considerations of the background and the patient's history and the differential diagnoses, et cetera, et cetera. And so
I agree with that. I agree with that, Jean. I agree with that, Beth.
And that is what our chapter talks about, basically, is that there are two sets of guidelines and that there's clinical judgment should be permitted because, for heaven's sake, otherwise let's not bother sending those guys to med school, because what good is it if they're not allowed to use their clinical judgment and they're basing that on guidelines that were on the National Guidelines Clearinghouse approved by AHRQ.
What if their decision is it's dangerous and it's ineffective? Do they have to present the alternative treatment?
Oh, David, what you're telling me I've been giving dangerous medications for years, successfully treating those patients. Sorry to hear you say that. Please, let's vote.
But sorry, I have one more question on the procedure, Jim Berger. So if the vote is about the whole chapter, and so hypothetically the whole chapter is voted through, but there are areas in the chapter that people seem to have, disagreements with. Let's say the whole chapter is voted through. Is there then the opportunity for people to make motions on certain sections if they want to then supposedly go through with minority reports on certain sections? I'm confused on that procedure since it was established last time. So can you bring...
It sounds counterintuitive to me, because if you vote it through, then it's voted through and it's approved.
We're right. So that's why we need to make sure this is clear. So last meeting, the new procedure was established. It was new, that in order to write a minority report, you have to be in the minority on the chapter itself or on a section. So that's why I'm making sure this is clear. If the chapter is actually voted through, then how are minority reports allowed if the whole chapter is voted through and you, per se, wanted to still provide a minority report on a certain section?
Leanne, this is Jim. For clarification, the individual would have had to vote no on the chapter for them to provide a minority response. If they voted yes on the chapter, they have no reason then to provide a minority response.
So you have to vote
no. I would imagine the reason for no could be specified in the minority report, so it's clear it's not on everything, but it's on a particular element of it.
Exactly.
Okay, so thank you, Jim. So you have to vote no, even if you agree with 99% of the report, but there's one thing that you really feel passionate about. You have to vote no in order to provide a minority report.
On the chapter, that's correct.
Well, that's
what we did last time. It seemed
like
that's
what we did,
and that's about
this is
voting on a chapter and
it shouldn't have been
still being able to include their minority report, even if they agree with the chapter, they can still provide a minority opinion.
No, not now. Not based on what was set up last time. Now, if you agree with let's say I agree with the whole chapter. I want the whole chapter to go through, but I want to provide a minority. I'm just saying hypothetically, I want to provide a minority report. Now I have to vote this chapter no. Based on what you put. Oh, that's terrible.
Could we call the vote, please? We've had ample time for discussion. There's nothing new being said. We have a motion on the floor.
I just want to make sure, Pat, everyone understands how that procedure works.
Well, I think if they don't understand it now, it's because they don't want to.
That's not true. It's confusing.
Has it been said here? About 500 at least. I'm sorry. I don't mean to be rude about this, but, we need to move on, and we have a motion, and people need to express themselves one way or the other, and that's what this is about.
Well, I just wish we could address sections of this and not the whole thing because, it's just throwing the baby out with the bathwater.
I think that, no offense, Ben, but the government long time threw out the baby in the bathwater, and those are our patients. You threw them out, you left them there, and this, to me, is just stomping all over them. And so I don't think it could get much worse. That's and I've never spoken this way at anything I've sat on before in this manner. But I just feel like this is, it's so ludicrous. I can't imagine what the people are thinking out there, but I can be pretty sure of it. And it's disgraceful. It's absolutely disgraceful. So let's get it over with. If you're going to cut us out, then let's get cut out.
Pat, I'd just like to go on record making a statement that what I think is the most profound finding from the Klempner trial, seropositive and seronegative, is the documentation through quantifiable criteria that the patients who met the eligibility for post-treatment Lyme disease syndrome were, in fact, ill to the level of someone with congestive heart failure, which is beyond the level of myocardial infarction. So that was proof that the individuals are indeed ill and need to be addressed, and they need to be understood in order to manage them properly. So I don't think we disagree in needing to help the patients.
is it appropriate to offer an amendment here to and try and say we approve the chapter with the exception of certain comments, areas that need to be addressed? Is that possible to do that?
I think we've proven it isn't today.
I would be supportive of that. I would be very supportive of that because I don't like the procedure that was established on the minority reports, which means you have to vote down the whole chapter in order to have some adjustments in certain content. I think that's terrible.
Leanne, I just wanted to say that's not necessarily. I mean, that's the procedure, but the thing is, there were opportunities earlier to not get to this point. We actually did have, I think, there were motions put forth on particular sections in previous meetings that actually didn't get seconded. So we didn't even go to a vote, which meant that there was no second person who thought those particular sections were worth voting on. So, unfortunately, we've gotten to this point where it isn't either or. And to address what Sam was saying, it may be possible. To me, it's not acceptable at this point. Well,
I agree with you. Because I advocated about 15 minutes ago. I advocated not to make those changes, not to that we had all those months to put in our input. I advocated for that, and I was making sure that we didn't have to disrupt the process. However, last meeting was the meeting where this minority report thing was put into a new process. And so I don't believe it was clearly understood, and I'll be the first to admit I wasn't understanding it until now. Right in front of me, there's an understanding that you have to vote the whole chapter through without any room for a section to have a little bit of change if you don't agree with a certain little section that you want some change to. In other words, some editorial changes or here and there in order to vote the whole chapter through. I'm not comfortable with that because I think personally, I'm just going on record, I think it's a very important and very good chapter, and I would like to vote it through. However, there are certain areas that I think need a little bit of changing. And now that I have to make a choice between one or the other, unfortunately, that's terrible. I don't want to have to not put the chapter through, and that's my personal statement. And I'm fine saying that on the record.
And I understand how you feel, and I think that we have proven that heretofore we haven't been able to have those changes that we could agree upon.
We had those changes. We made changes. They were not challenged at the next meeting. The problem is that there are those of you, and I don't know how many there are, and at this point I don't really care. You don't want to do this. You don't want to do this because you know that this is wrong, first of all. This is totally wrong what's being done, and it's all part and parcel. You keep saying this process was changed. This process wasn't changed. This was the process it always was. But you tried to alter it, and you did things that were not brought up to the public. And we discussed them. The 2 hours David talked about and blamed me for, they were because you couldn't make up your minds as to what to do about it. Well, here you are. My mind's been made up for, I don't know, at least now a half an hour, 35 minutes. Had the motion on the floor, and Scott and I, since we put our blood, sweat, and tears into this, we know where we're at. And where we're at is we want the vote on this and let people do as they feel in their hearts they have to do.
Pat, there's something that is not accurate. Last meeting, up until that motion was put on the table about the minority report, if someone wanted to vote a chapter through, they could still vote it through and still put a minority report through if there was a section that they wanted changed. That's what's different here.
No, what was different was that behind the scenes, you people tried to, I don't know who you were because I still am unclear about that, made changes in the process and then declared those changes, but and we're like, what is this? What do you mean a person can not vote on this? I had 3 different responses on that issue. And so, no, what happened was, in public, I forced the issue of it being brought to a decision in public that this is what the working group wants to do. And that's the way the working group voted. And for you to say that you didn't understand, well, I'm sorry. If after 2.5 or 2 hours, whatever it was, of that discussion you didn't understand, I don't know why you understand now after maybe 45 minutes of discussion. But the point is, we want to move forward, and that's where we're at. And Scott and I think, are in total agreement with that. And we're not going to go back and redo this. We're not going to go back on these comments that are comments with no substance and have already been litigated. This is like relitigation all the time, every meeting. And we're not going to do it with one meeting, which you were also very clear to tell us, which we, the working group, never heard, that the next one is just simply going to be an administrative meeting, because we don't hear these things. You meet behind the scenes, and you don't tell us about your Monday meetings and what they entail. And so we don't have any way of knowing that what's coming down the pike next. So let's not make it out here like there were changes that were made that were not valid. So there's a motion and a second on the floor. Let's call the question.
And we can deal with it after the vote somehow. So let's vote.
I think we need to vote.
And David Walker can run through the list.
Okay. Beto?
So, just to be clear, if I say I approve, I approve the chapter, right? With the caveat that it can be.
Then you
right?
do not get to write a minority report. That's correct.
Approved.
Okay. Angel?
Hi, I also approve. I'm in support of folks being able to write a minority report, but that is not something that I will be doing. So again, approve.
Okay. Ben?
Yeah, I can't approve it as it's currently written. It's sad because I like what's there, but more, it needs to be balanced. So if I'm forced to vote yes or no, at this point, representing the CDC, I have to vote against it.
Okay. Scott Commons?
I vote to approve.
Dennis Dixon?
I vote not to approve. Same rationale with that.
Okay. Sam Donta? Approve. Todd Myers? Kevin Macaluso?
It's still confused why we can't.
We can't hear you.
Individual comments, but that's not the point right now, so I can't approve it because that's still that table. I wanted to talk about that, so no.
Todd Myers again.
Yeah, sorry, I was on, couldn't get off of mute. It's difficult because you have to prove the whole thing or not, and not just parts. So it doesn't seem like we have consensus, and I would like that we'd have some consensus so we can go forward as a unified group. So I'm going to vote no on this.
Gene?
No.
Pat Smith?
Yes.
Keith States?
I'm going to vote to approve, with the understanding that others are going to pursue a minority response. I understand that we are not going to reach consensus in the current state, but I encourage others like Dr. Beard and others that have kind of voiced their concerns with regards to having the moderate tone and having all voices heard, that can be amenably done through the response process.
Okay, Leanne?
Yes. So I've made a lot of statements, and the working group members have heard. And I want to particularly thank some of the working group members for their personal insults and for trying to undermine my integrity. I really appreciate that. Obviously, you don't know me, so thank you for that. With that said, I'm looking for the greater good of the report, and I believe that this is a very important chapter, although I will be clear to say that this is not the only chapter supporting patients. The entire report is supporting patients. The entire report. Not this one, not only this one. Because of that, because I believe that the majority of this content is crucial to be represented in front of Congress, I am voting this chapter through. Although there are sections in here that I do not believe are properly written completely, and I'm asking my other working group members, because I support you and I support your position, to please write the minority report. Thank you.
Dr. Cooper?
I vote yes to accept the chapter. Thank you.
And my vote is no. We have 1, 2, 3, 4, 5, 6, 7, 8 votes yes, and 1, 2, 3, 4, 5, 6 votes no. So the chapter goes through. And I do believe there will be some minority reports.
I just need to ask one question. What was Beto's vote? He kind of faded out and I didn't hear it.
I recorded it, I guess.
You said yes, Beto?
Yes.
Thank you.
Right.
Yeah, our next agenda item is the executive summary.
Excuse me, David and Deanne, I have a suggestion for the very first line.
Okay, let's hear it.
Yes, I would like it to read the Tick-Borne Working Group 2020 report to Congress addresses continuing key gaps in the diagnosis and treatment of Lyme disease and adds focus on other tick-borne diseases. I think that's a stronger statement in regards to that we want to continue our focus on Lyme disease. As it kind of says the focus is 2018 report, but we're still focusing on it. In this way, we said we're adding additional focus on the other tick-borne diseases as was appropriate for this particular working group. I think we can accomplish both of those goals. The group is okay with that.
I think that's what it says.
Well, but I think it says it a little bit better, David. Is to address continuing key gaps on Lyme disease. The diagnosis treatment of Lyme.
You want to make a motion?